Welcome to Brandturks, a series dedicated to brands, entrepreneurs, and startups. I'm Sonia, and I have a guest, Chris George, with us, who is the CEO and co-founder of Qube. Hi, Chris. How are you doing? Welcome to the show.
Very good. Thank you so much, Sonia. Thank you for having me.
It's our pleasure. So let me begin by asking you, what is the genesis of Qube?
So, Qube Health actually is a healthcare payments company, and we built this business with the foundation that in India, making healthcare payments is really difficult. It's difficult for various reasons. The most important one is because as a country, we are severely underinsured. So, most of us find that health insurance is not enough, or there are members of a family who are absolutely not covered under health insurance, as a result of which we have to pay from our pockets for a lot of healthcare expenses. When we pay from our pockets, we either pay from our savings or we borrow from outside. And naturally, because the pools of money are different, some people may have it in savings, some people may have it in their checking account, others may have it in cash, and even some parts of our country, they even pay it in gold. So we wanted to consolidate everything together and make money available at no cost, so that you can pay for any health expense that you or your family may need instantly through the app. That's really the business of Qube.
Oh, wonderful. That's really fantastic that you are democratizing the health space. And I understand you are making access credit available at a zero EMI.
That's
So
correct.
let us understand, what is your revenue model there?
So, from our perspective, first is we make sure that the user does not have to pay anything at all. User in our case is the employee of a corporation that has signed up to our service. The company that they work for pays us a small subscription fee per employee per year. And it's as low as 720 rupees a year, which is less than 2 rupees a day, per employee per year. That's essentially the only money that we make. To the employee, it is absolutely no cost. When I say no cost, meaning they don't have to pay any interest, they don't have to pay any processing.
Okay. So tech is a big enabler. So how are you leveraging technology?
So when we look at the payments ecosystem in our country, today we are all used to paying through UPI. And by paying through UPI, we've been able to empower ourselves through the use of our mobile device by simply scanning and making a payment. I mean, a few years ago, you would have not been able to think that this was possible. What Qube Health has done is we've integrated a payment system like that, so that you can essentially choose your modes of payment. It could be your own credit cards, debit cards, your personal bank accounts, or a credit line that is made available to you. And through the Qube app, pay any healthcare provider across the country. And when I say any, I mean literally any hospital, clinic, doctor, diagnostic center across India. You simply scan the QR code and then you will be able to make the payment. The technology play over here is the entire financial technology or fintech infrastructure that we have been able to integrate and build, that plugs in and brings together lenders, brings together healthcare service providers like hospitals, clinics, etc. It brings together the employer or the Indian companies and their employees. So all of this put together is the technology.
Oh, wonderful. So what's been your biggest challenge and if you would like to share some success stories?
Certainly. I think building a business which is at the intersection of both financial technology and healthcare technology in itself is challenging, because these are two very complex and large industries, and we happen to be straddling both of them. But successes have been fantastic. We've been able to impact the lives of 150,000 employees of our client organizations that have been impaneled with us. These are all subscribed users who are using our product. We've been able to activate a credit line of 1,000 crores of medical credit at no interest that is made available to these individuals. It essentially really warms our heart when we hear about stories from our users when they say, look, I've been wanting to get a knee replacement surgery done for my mother, but I have not been able to do so because I was accumulating money in savings. But now with Qube Health, I'm able to use that money right now and just pay you back over the next 12 months. So I've been able to prepone the care that I was providing to my mother by 12 months, which is 12 months of healthy living and nice living that my mother is now able to do thanks to Qube. So these are just few of those examples that we've been able to kind of do.
That's incredible. That's a big impact. I must say,
Thank you.
compliment you for that.
Thank
So what's
you.
your brand vision and your philosophy?
Our philosophy is really simple, and in many ways, that is our mission as well. We want to change the way Indians pay for healthcare. We want it to be the first port of call. Lift your phone, scan any QR code of UPI across the country at any healthcare provider, and simply make that payment. The money can come from multiple sources, right? So, therefore, changing the way we pay for healthcare is our philosophy and our vision. We also want to make healthcare really simple. It's too complicated right now. We need to make it really simple.
And what are your expansion plans?
We are confident that in the next 3 to 4 years, we will have activated $1 billion of healthcare credit. That is our goal. We want to be able to impact the lives of Indians so that that much money is made available to them to pay for any healthcare expense. That is really our focus. We are an India-focused business, and we believe that we are solving a problem for Bharat.
Wonderful. And what is the role play of generative AI?
I believe that there are multiple areas that Gen AI can play a role. First and foremost is to make sense and understand your healthcare data. As a healthcare payments company, you can imagine there is a lot of information that we pick up from the user. We are, of course, information security compliant, we are ISO compliant, HIPAA compliant, etc. So that data can actually help find patterns in the healthcare expenses of a family. And those patterns can actually help that individual plan their healthcare expenses better. So Gen AI allows us to find those patterns much more faster, much more better in the kind of providing that care, and hopefully, helping our users lead healthier lives.
Wonderful. So I would like to know, what are the qualities or the skill sets you look for when you hire people?
Oh, wow. First and foremost is we look for a drive and ambition to actually create an impact. When all the team members that essentially work for Qube Health, we call them the Qube crew, are working with Qube because they believe they are building a product for their own families. So that is number one that we seek. Number two, we believe that individuals who actually want to go above and beyond what their mandate is most important. A lot of team members and employees in organizations want to be limited to just what they've been told. Here, we want them to focus on a whole lot more. So those are the qualities that we look for. We have people who come in from different walks of life, different languages, different cultures across India that have decided to move to Bombay and work with us.
Wonderful. So on a lighter note, what are your hobbies and passion?
Oh, okay. Well, apart from Qube Health and what I'm building here to create an impact, I love movies, I love music, love motorcycles. So 3 M's over there.
Wonderful. And what is your leadership mantra?
Solve problems on a daily basis, be an assistant to your people, and help them become better leaders.
Okay. How will you define Qube Health in 3 words?
Changing the way you pay for healthcare. Those are more than 3 words. Simplifying healthcare payments. Those are 3 words for you.
Super. So that brings us to the end of the episode. It's been fantastic and a pleasure having you with us. More power to you and more power to Qube Health.
Thank you so much, Sonia. Pleasure talking to you.
Likewise. Thank you. Cheers.